Hi, welcome everyone to our third collaborative responses to COVID-19 web conference. We're going to be getting started in just a couple of minutes. We're waiting for a few panelists to join, but thank you all for being here, and we'll get started in just a few minutes.
Okay.
Wow, 40 attendees.
Oops. Hey, all, sorry, I just realized I was on mute and I did my whole introduction. Marcella for texting me. Hey everyone, Amanda McAllister-Wallner here with the California LGBTQ Health and Human Services Network. Welcome to Collaborative Responses to COVID-19. This is a series of web conferences that we've been really happy to host with our partners over at End the Epidemics and Equality California. Courtney, do you want to say a couple of words about who End the Epidemics is?
Sure. So hi, everyone. My name is Courtney Pearson. I'm the Vice President of Policy at the San Francisco AIDS Foundation, and also helping to spearhead the End the Epidemics Coalition. We're a statewide coalition of organizations and local health departments that are calling on the governor and legislature to create a strategic plan in California and HIV, hepatitis C or HPV and STDs. And so we've been working on this effort for a couple of years and kind of retooling that given the COVID situation, but continuing to push for more increased access for public health, which COVID has shown us is very, very needed. Thank you.
Yeah, thank you. And then also co-sponsoring with us is Equality California. Tammy, I don't know if you wanted to
Hey everybody. Yeah, thanks Amanda. This is Tammy with Equality California. We have a wealth of wonderful speakers today, so I'm not going to be on the screen, but I will be here and look forward to the conversation. I'm the legislative manager at Equality California. I'm based up in Sacramento. I work on our legislative package each year. And we also have a programs team that is scattered around the state, but based primarily in Los Angeles, which is the launch pad for a lot of those programs. We do work around school, safe and supportive schools, mental health, census outreach, and a range of other things as well. So we're looking forward to today, and thanks everyone for joining.
Yeah, and thanks again everyone for being here. We have, on our first two calls, we got a lot of questions about from all of you about how this how COVID-19 is impacting LGBTQ people, specifically in rural areas who may not have access to the same resources as people living in some of the big cities, whose local governments may be responding in vastly different ways. And folks who just are facing additional challenges of people being spread out, or some of those having differences in access to infrastructure like high-speed internet and other things. And so we thought that this was a really important topic, and we heard from all of you that you thought it was too, and wanted to take some time to specifically address some of those issues. We're really happy to be joined here at the beginning of our conference by Assemblymember Dr. Joaquin Arambula, who represents Fresno County. And Dr. Arambula, I see you on, yes, I see you on here, and let me go ahead and unmute you.
Thank you for that.
Yes, hi, welcome.
Thanks for having me.
Yeah, great. Do you want to take a couple of minutes just to introduce yourself and some of the work that that you do in the legislature?
Sure. So first, I'm Joaquin Arambula. I represent the 31st Assembly District in the central San Joaquin Valley. I represent half of Fresno County, 14 cities, many of them rural, small county cities that are farm working communities. One of them I spent 10 years in, working as an emergency room doctor on the front lines of healthcare, and feel very connected to this pandemic vicariously through many of my colleagues who currently are heroes in my eyes. But what I saw firsthand was the lack of access to care that occurs in so many of our communities and goes unspoken, but oftentimes can be prevented if we had programs in place that people could participate in. And now have the honor of serving as the chair of our budget subcommittee on health and human services, where I hope to oversee the programs that many of my constituents and patients now rely upon. The programs that we know that make up the core of our social safety net, including Medi-Cal, CalFresh, CalWorks, will be leaned upon during this pandemic. And I'm trying to make sure that they're equitable and culturally competent and extending in a linguistic way to communities that oftentimes don't feel like they get included. And I'm proud to be able to bring that lens to Sub 1 and to work during this pandemic, but really am honored that you would have me here today, and happy to answer any questions that you may have about specific issues that we're working on. But these are unprecedented times, and it will take us as public servants and the public to come together to figure out what we can do to improve our communities and to keep them safe. So thank you for having me today.
Yeah, thank you so much for being here and for the work that you do both as a healthcare provider and as a leader on health issues in the legislature. Both of those things are very needed in all ways. I wanted to announce a couple of questions for you. Oh, sorry.
Sorry, I just wanted to This is Assemblymember Jim Wood. I cannot been able to get onto the webinar, so I'm on the phone. So just wanted to let you know I'm on the call.
Oh, great. Thank you so much, Assemblymember Dr. Wood. Thank you for joining us, and I'm sorry about the technical difficulties.
It happens.
Yeah, it does. It does. I think we're all really grappling with the limitations of technology right now more than ever.
But so is our rural community trying to access healthcare right now. And just think about how difficult it is for you, Jim, to get onto this call. Are they able to do telehealth and to access without having broadband in your communities? And so I think it's perfectly appropriate to have that conversation right now because many people in our communities are having them.
Well, we have been struggling with broadband issues for forever, it seems, and the digital divide is alive and well during this crisis, and it is impacting healthcare. It's really impacting education. So many kids and students cannot really do the distance learning that we'd like to because they simply don't have broadband access, and it creates a huge challenge for us. We are fortunate that there have been some provisions for telemedicine. However, if you don't have broadband access, you can't really get to it, and it also is somewhat limited for some of our older residents who are really may not be as tech savvy and be able to do that, and so those create additional challenges for us.
Well, I know you've been a long time, and I don't mean to try and actually have a conversation on telehealth, but I think it's actually important, right? I mean, I am in the central San Joaquin Valley, and I used to work with Dr. Barnett. I really liked her. And she was a trans doctor who really provided services to a community who felt safe coming to see her. And it was really sad for us when she left and moved back to San Francisco because she felt more at home there than she did in the Valley. And I think that telehealth can actually help us to bridge some of this so that those of us who are feeling alone in some of our rural communities have opportunities to connect across this medium that I think will allow us to extend care. And I think it is something we should really try to make sure we lock down. So I'm going to be explicit because sometimes we're coming up on budget season and it gets me into a frame of mind of trying to actually get things done now. And one of those is that we had changed the reimbursements during this pandemic to make telehealth visits the same as in-person visits. What that allows us to do if we continue that past the pandemic is to incentivize and increase telehealth. I think it puts it on the same footing as in-person visits, and we should be trying to make sure we secure that first and foremost so that we don't end up sliding back to where we were before this pandemic.
Yeah, thank you for saying that. And I think it's helpful to hear maybe what some of the silver linings are with increasing, some of the ways that this could increase accessibility to trans health services or, other types of services, particularly for people in rural areas. Dr. Wood, you didn't get much of a chance to introduce yourself. I know I'm familiar with your work, and I think many folks on the phone are, but would you mind taking a minute just to introduce yourself for folks who are on the call?
Sure, thank you. First of all, thanks for the opportunity to be here today. My name's Jim Wood. I represent the 2nd Assembly District, which is the largest district for any Democrat in the state. It's 300 miles from one end to the other. It includes the northern half of Sonoma County, Mendocino, Humboldt, Del Norte, and Trinity counties. So it's an incredibly beautiful district, but it is a very rural district. I have one city that I represent, and I only represent half of it, which is about a little over 200,000. And then the next biggest city after that is 27,000 people. So I'm very familiar with some of the rural challenges that we face and access issues. I'm the chair of the health committee. I've been the chair of the health committee for going on 5 years, I guess. I'm 5 years now, which makes me the longest serving chair in the last 20 years because of the way term limits were. And so I've become very familiar with the issues related to our communities, all of our communities, and especially issues related to LGBTQ populations. And it is particularly challenging in rural areas. I think there isn't always the acceptance of everyone in any population, and we see some of that play out in our communities. During this crisis, I'm not familiar, or I'm not aware that there have been any significantly increased challenges, at least not that I'm aware of. But I know they're there, and so it's our job to try to figure out how to best serve people. I think my biggest concern going forward through this year and into the next is that we fight to maintain the level of funding that we have for so many programs, and also look for additional funding, and it's going to be tough. So I'm honored to work. I sit on the budget subcommittee under our chair, Dr. Arambula, and as such, we look at all of these issues from the fiscal perspective, and you have in us champions who really want to make sure that our programs are protected so that we can provide the services that are necessary for everyone.
Great. Thank you. Thank you for all of the work that you're doing to make sure our communities are having as little disruption to services as possible, which is a little bit unavoidable right now. But yes, we are appreciative for the work you're doing. And I think actually that last point is a great segue into one of the questions that we've heard from some of our partners about how the state is addressing these challenges. And also for those of you who are on the webinar today, you can feel free to type in some questions into the questions box as well if you do have those, and we'll be monitoring those. We may not get to all of them, but we will do our best. So one of the things that has come up is that there are our community partners in rural areas are experiencing some challenges accessing federal funding in rural regions, and want to know, how can the state help to mitigate some of those challenges in accessing federal funds and address the specific needs of rural communities through some of the state interventions?
Jim, you want to go first?
Well, I guess what would be helpful is to really understand what funds you're not unable to access. So for me to be helpful, that's a critical component here, and I don't know. So if you don't have to provide that for me, today, or right immediately on this call, but we're more than happy to intervene and do everything we can to interface with our federal partners and see how we continue to draw down the funding that our communities deserve.
Well, one of the and I would just jump in and say sometimes we lack the technical expertise to be at the front of the line to access some of these funds. And by the time you're aware of it, you miss deadlines, and just it's a harsh reality of limited resource. And so, you know, I do spend a lot of time thinking about it, because it feels like to me that the rich keep getting richer and the poor get poorer, and that this is a real way for us to turn the tables if we can be intentional about it. And so I'll give you a specific idea I've been floating around and don't know when it will be useful, but oftentimes we disperse money and have counties have matching funds for it. Well, some of our poorer and smaller counties really struggle to come up with that during tough economic times like now. And it ends up hurting poor counties like mine. During the last recession, we weren't able to pull down state funds for many of the programs in the Valley because we didn't have the matching funds that were necessary. And so I'll be keeping a very close eye on if that language is included at some point, or tried to be, because I want to make sure that all of our counties, including the counties that can't afford it, that they have access to monies that the state will be providing. I don't have as much helpful insights into the federal government, and we'll continue to look as each of these installments come down. So.
Okay, could I jump in really quick for the?
Yeah, please.
So I had reached out to Amanda before this meeting. My name is Brian. I'm with the Source LGBT Plus Center, and we're in Tulare County. So we totally understand this issue, and specifically, we've been wanting to. You know, it seems like funding like Ryan White, HOPWA, those funds that were designed to and created to help folks living with HIV often sit at our county level and are subcontracted out to whoever. And we're sort of lucky enough now to be part of the conversation around Ryan White funding, but we're sort of baffled, like, that we weren't a part of the conversation and sort of overlooked. It disproportionately affects our community. We already have relationships with those clients, and there's a lot of homophobia and sort of cronyism in our county in terms of nonprofit funding, and it's really disappointing. And so for us as LGBT folks and people who are working with people who are affected by HIV and lack access to these programs and culturally sensitive disbursement, we're looking to fix that, and we just don't know how, because we're a small fish in a poor county, and but we're ready to have those conversations and figure out, you know, how we advocate for our clients, and also advocate at the state level to really get attention on where these funds would better be dispersed.
Hi, this is Gabriel. I am the CEO of True Evolution. We're serving Riverside and San Bernardino County. And I guess the one policy specific barrier that we sometimes have to accessing funds, particularly those that are designated for rural regions or rural specific counties or rural serving territories, is that there is usually specific designations that are tied to the eligibility requirements of rural funding. So if people want to reference to the recent $105 million that HHS announced as being designated to rural communities, it probably was in a press release a couple of days ago. If you specifically read the language of the funding, is that it specifies rural hospitals and rural health clinics. And so typically when you're talking about rural funding, there's usually only 2 to 3 designations that get a majority or are eligible for a majority of the funding, depending on the type of organization you are. So it's usually FQHCs, federally qualified health centers, RHCs, rural health clinics, and rural hospitals. If you look at the majority of rural specific funding, it's those 3 federal designations that absorb the largest of funding. And I'm going to assume my colleague Brian is in the same position as True Evolution, where we are this kind of community-based organization that provides social services. Maybe we may or may not have primary care services, but we don't have the federal designation that often allows us for community-based orgs like us to be able to access those kinds of funding. So I know that that's something I'm finding frequently when I'm looking for award opportunities from the feds.
And this is Courtney. I want to jump in here too. Brian, we would love to have you join us in policy conversations at the state level, either through the California HIV Alliance or the End the Epidemics Coalition. We're wrestling with this a lot. The county, it's often easier to get funding for the counties. It can go out faster, but then we see such a disparity in terms of how that funding gets out to the community. So it's really a challenge that we have been wrestling with, and would love your expertise and guidance on how to navigate that. So we can connect after. I also just wanted to mention that the End the Epidemics and working with California HIV Policy Research Center just launched a survey. It went out yesterday, and we're really trying to gather information from across the state specific to HIV, HCV, and STD services, but LGBTQ services as well, about how this is impacting the services we provide. And then we want to use that information to help with the advocacy of this so that we can have more concrete information. So hopefully everybody received that, but if not, maybe we can distribute that survey after the call.
Courtney and Brian, before we leave the subject, I was hoping just to kind of put a pin in it and have some follow-up with Rosa, who's my staff, who's on this call as well. I'm quite sensitive to subsidiarity, the handing of funds to counties, because not all counties are created equal. And coming from Fresno County, I can appreciate the struggles of Tulare, and know that there's a lot we can do by helping to ensure funds go towards their intended purpose, and would be happy to work with your organization to see what we could do to improve upon that. And so I think for us, it's what are we doing by June 15th, and then what can we work on after that? And would be happy to spend some time having Andrea and DeRusa think about it and figure some solutions out. And so happy that we've identified the problem, and think that we should try to work on it.
Yeah, that would be great. We've tried a couple different ways through trade-level language, and I think we're getting closer, but I don't think we reached it. So would love the expert guidance.
And we're much better positioned to help with at the state level with state level funding that goes to counties, and how that gets directed to different groups. Where we will struggle is with our federal partners, and so that means we need to engage with our members of Congress and see that things happen at that level. But we just simply don't have with the exception of our members of Congress, us as state legislators don't have a huge amount of influence with what happens at the federal level, which is hugely challenging. There's so much federal funding that comes to states, and where there's a federal match to the state match, and which allows us to leverage our dollars, but we don't always have the ability to influence how that funding, where that funding goes from the federal level. So, but I'm more than happy to talk to my members of Congress. I have two that represent different parts of my district, and make sure this is on the top of their list to be able to push for.
Gabe, you should share your letter.
Yes, so myself and Tony Young, who's the executive director of the community education group out of Shepherdstown, West Virginia. So they are our rural cousins, on the different kinds of experiences. We talk about the different phases and different dimensions of rurality. So it's a very different experience over there. We came together and have circulated a letter, and anyone who's on this call that hasn't that hasn't seen it, I can certainly forward it out. We sent it out through the in the epidemic work group listserv, and it's calling on Congress in the CARES Act phase 4 to allocate $5 billion that would be specifically to rural organizations. And the intention is for it to come out of the Health Service and Resources Services Administration in the Office of Rural Health Policy. That would be the intention of where the funds could sit. And specifically, the underlying part of our advocacy is what I mentioned earlier, is that we will be very specific in our language so that there is a larger type of provider that could access these sorts of funds. And what we want to make sure is that we are not simply advocating for what people seem to be as a usual fix-all, give it to the hospitals and the solution is solved, but rather acknowledging that there are other kinds of service providers that are vital to not only the COVID-19 response, but to keeping and maintaining and retaining people living with HIV into care amidst this kind of complicated model. How do we keep our clients who are already in care, let alone respond to COVID-19? And so we recognize that there are infrastructure issues, not only with physical infrastructure, so that's being able to have the devices and the technology, not only internally as an organization, do we have the physical infrastructure? Our building doesn't qualify for fiber optics. So we actually have to get satellites that are going to beam on a separate router, and then that separate router will provide the internet. And that's an additional $450 per month increase in our bill because it's a different kind of service. So there's physical infrastructure, there's the broadband service, the streaming, the subscriptions. For those of you that have upgraded your Zooms, the Zoom Pro version is $2,000. That's $2,000 that CBOs don't just have lying around. You have to make sure that you get all the integrations for like telehealth version, and there's a telehealth HIPAA compliant certification that's an additional $400 a month. I mean, like, there's all these additional fees with the actual streaming, let alone what the streaming access is of our clients and whether they're using Obama cell phones. And then the third one is mobile services. So I think when you're absent of a telehealth model, mobile is the only other option we have. And so for those of you that are familiar, a full mobile health clinic is around $200,000 to $250,000 from the purchasing of the unit to the retrofitting of the unit. So you're talking about large capital expenses. And so these are the unique kinds of expenses that rural regions typically need, and organizations such as community-based organizations that don't have large budgets or infrastructure typically don't have access to. And so that's the intention of what hopefully the advocacy on these funds would result in. So we're still taking sign-ons. So if anyone wants to sign up, please reach out to myself or Courtney, and Courtney can connect us. Yeah, that's our letter.
That's great. Thank you so much, Gabe, for sharing that. I think that actually feeds in a little bit to my next question. Do we? I know we have some limited time with Dr. Arambula and Dr. Wood. Are you able to take one more question?
I am. I am preparing and should foreshadow and give you early notice. We're having a sub-1 hearing on Monday. And so we're having a follow-up call to start to prepare for it, but wanted to make sure that you were tuned in and paying attention, and we'll be on the Assembly site streaming. So happy to take another question.
Thank you. I think along the lines of what you just mentioned and what Gabe and Brian were kind of saying right to, what gaps have you or your team kind of identified in the federal funding response to COVID-19, and can you shed any light on the state's plan to address those gaps?
You don't mind if I soapbox a little bit, do you?
That's why we have you here. Please do.
I was particularly offended by the unjust nature of the federal CARES Act that did not recognize our undocumented community. I think it's was intentional and purposeful, and really hurts communities like mine. I have over 20% of my community who are immigrants or mixed status families, and I really think it was a difficult pill to swallow, because we too are going to struggle in terms of making our tables and kitchen tables work, and how we make ends meet is going to be challenged over these next few months. And so I've been spending a lot of time trying to think about how we support the undocumented community, and have a few that we've done. Most recently, I've been working with the Latino Caucus, and we got emergency aid relief of $75 million of public resources, partnered with $50 million in philanthropic dollars, that is going to provide real money for several 100,000 people. And I think we have to recognize that it's not sufficient to cover the need, but it's a start, and it's helping right now. We also did extend some of the protections for businesses and paycheck protections that will allow our immigrant-owned small businesses to stay open during this COVID-19. They again were excluded from much of what was in the federal package, and that will allow them to continue to be entrepreneurs and for us to recover. So I think that's the just largest hole I saw within the federal package. Is, look, if you're going to say it's essential for farm workers to be out there, then I actually think it's essential for Congress to pass comprehensive immigration reform. I don't think they should be at home while they're telling farm workers to go out there and denying them access to the same resources. And so sorry for soapboxing, but that's how I feel about, what has been an administration that has not looked favorably on all of us in the community. And I'm proud to author AB4 and try to extend healthcare coverage to all, and think the governor has provided real leadership by making sure that everyone has testing and treatment during COVID-19. So I'm very appreciative of that, but no, we still have a long way to go to try and create equity.
And I'll add in here before I have to jump off, but I do want to say that I think one of the biggest disappointments for me in the CARES Act was the fact that money to help offset actual expenses by cities and counties for COVID-19 isn't going at this point to jurisdictions under 500,000 in population, and that's very distressing. And with all due respect to our folks that live in larger areas, we don't in my district, and so that means that cities and counties, with the uncertainty of how much will they get anything at all, are being a lot more cautious in how they spend money, and that is really, really troubling. I'm also concerned, and because of that, I raised a question in our budget oversight hearing last week ago, Monday, to say, what is the administration planning to do? Our state administration, with the $9+ billion that isn't going to the large cities and large counties, is that going to go? Is that going to go and to smaller jurisdictions? And I was not really satisfied with the answer, because it didn't. It was basically, well, wait, the governor hasn't decided. Let's see what happens with the May revise. But I think another big oversight with the federal package is that there really isn't direct relief for some of our nonprofits, or a grant program for nonprofits. Especially in I'm more familiar with rural. I have less familiarity with a lot of our large urban areas, but I will tell you from my experience, we have a wealth of nonprofits in our district that provide tremendous services to people on a variety of different levels, and they're hurting badly. And there's nothing as far as relief anywhere for some of these amazing organizations that do such great work. And I think that's a big hole there. There's not a recognition within Congress, the value that so many of our nonprofit organizations bring to the quality of life for people. So, you know, it's we live in really challenging times right now, but you know, I hope that we can continue to push and advocate and do everything we can to get resources for our communities.
Thank you so much, both of you, for joining us today. Thank you for your leadership on, you know, securing resources for rural communities and for undocumented Californians. And I know that if you need any testimonials or personal stories about how this is impacting nonprofits in rural areas, we have a number of folks on this call who would be more than happy to provide, you know, some stories about you know, about what that's looking like on the ground, including a couple of folks from your district, Dr. Wood. So
great. Well, thank you, and please, you know, if they're not, you know, please feel free to connect us, and I'm happy to do whatever I can to help.
Thanks for having me as well, and hopefully you guys will be able to tune in on Monday. I do think there will be some opportunities for us to collaborate. Just to foreshadow a little bit, we mentioned it in our last hearing, but Dr. Wood and I, when we did a select committee, did some work with MLR, medical loss ratio. It was in the Affordable Care Act, helping to ensure our healthcare premiums are actually spent on healthcare. And I'm going to be pushing and advocating that we actually push our plans to help to buoy our healthcare system right now. And so hope that many of you will tune in to help us to be consumer protectors, because at the end of the day, it's our money. We're paying those premiums, and we should make sure that they're going towards their intended causes and not towards profits for some of these companies. And so just would be eager to have you guys participate and help us to elevate this cause.
Thank you, everyone.
thank you, everyone, and we'll see you Monday. We'll get on the internet.
Have a good one.
Thanks. Bye.
Okay. All right, and I apologize to be a disembodied voice again. My internet connection is apparently too slow right now to show video. So, you know, we're really happy to have two great legislative champions join us to talk a little bit about how the state is responding to you know, this current moment. And we're also really happy to have a number of champions from local HIV and LGBTQ serving organizations in rural parts of the state who can share a little bit about their experiences, some of the resources that they are tapping into and referring clients to, and also some of the challenges that are being experienced in rural communities right now. So I want to start by just letting you all introduce yourselves, all of our fabulous panelists. I will go in, I think, alphabetical order based on first name. That's what my list is in. So Brian, do you want to go ahead and introduce yourself for folks?
Sure, I'm writing notes. I'm Brian Poth. I'm the executive director at the Source LGBT+ Center, and we're in Visalia, California, which is in Tulare County.
Great, welcome, Brian. Buzz.
And Visalia, I guess, is not considered rural. It's a city, but we serve the entire rural Tulare and Kings County, so about the size of Connecticut and Rhode Island put together. So we're the only center in that area.
Yeah, you're not just a urban poser.
No, I mean,
That's me.
No, I think yeah, no, I love urban centers. That's where I learned what an LGBT center was. But yeah.
Yeah, thanks, Brian. Buzz.
Sure. I'm an 81-year-old gay elder. I'm a volunteer advocate in our community. I live in Sonoma County, in the town of Sonoma, actually. And it's really good to hear people talking about funding because that's a great concern I have. We have quite a large population here in Sonoma County because of our proximity to San Francisco, and also the Russian River was a great attraction for people back in the 80s. Now those people are my age or thereabouts, and so we don't have a center in our county that serves elders. I teach a class through our college older adults program called Aging Gayfully, and I'm able to reach about 30 or 35 people a semester that way. I'm also volunteer co-facilitator for a group here in Sonoma where I live, just called Sonoma Valley LGBT Seniors. We've been going since 2009. We originally had a paid facilitator, but the grant ran out, so now we're doing it with volunteers. And we have over 100 on our mailing list. So there's a real need in our county, a lot of isolation. I think people my age tend to be hesitant to connect with their non-LGBT peers. Those are the very people who bullied us in high school. So we hold back. And so as a result of the pandemic, there's just even more isolation. We're more invisible than ever. And that concerns me a lot. Thank you.
Thank you, Buzz. Thank you for all the work you're doing, and thank you for being on the call today to talk about how some of these issues are impacting seniors. Erica, I see you. Erica, are you there? Okay, we can come back to Erica. Gabriel.
Hi.
Oh, there we go. Hey.
Okay, I'm here. Just having some problems because I'm using my cell phone.
Ah.
Okay. So anyway, hi, my name is Erica Garcia, and I'm living in Windsor, California, Sonoma County for over 20 years now. I'm married with 2 children. They are 14 and 19 years old. They are 2 boys, 2 teenagers. And I have been volunteering, collaborating, and helping as much as I can with LGBTQ connections. We reached them initially because our older son is 19 years old now. He was openly gay at the age of 16. So we was looking for some information and help, support for him and for us to navigate with this challenge for us. And as we see how many challenges the LGBTQ community have to face, we have to jump in and help in many ways, because there are several challenges for our Latino LGBTQ individuals and the families, trying to comprehend what those challenges are for us, and how or find the way to support our children for the cultural issues, and because of the religion is constantly with us. And so here we are. So my husband and I love to be involved in the community as much as we can in our children's school, community, and there's several challenges that our Latino community have to face to the culture and the language that is a big issue in our area. So here we are.
Yeah, thank you so much, Erica. And I will share in a little bit some of the information that you shared about programming that you have for LGBTQ and youth, and particularly for Spanish-speaking youth right now.
Mm-hmm.
Gabriel, did you want to introduce yourself?
Yeah, sure. Hi, once again, Gabriel Maldonado, CEO of True Evolution, and we serve the Riverside, San Bernardino County area. Our region is about 27,000 square miles combined. Inland Empire is something familiar. People are familiar with that term. So we're bigger than about 5 states in the US. And while rurality has a variety of definitions, from plains to mountains to, you know, how severe the isolation is to the kinds of populations that you may serve, I think one of the things that we experience in our rural issues is the sheer volume of our region, and how while there are pockets of urban cities, like you're familiar with Palm Springs, I'm sure people are familiar with the city of Riverside, Rancho Cucamonga, Ontario, where the Ontario airport is. Those are city areas, but we have over 24 cities between the two counties, and you have areas that are like Hemet and Menifee and the Mid-Pass area. For those of you that have driven from Los Angeles to Palm Springs, there's an area in which everything goes dead and phones die and there's no off-ramp and there's nowhere to pull over. Well, so a lot of people don't know is that many of the affordable housing communities are tucked away in those areas. A lot of the Section 8 housing is there. I know someone specifically who literally lives in a no man's land in this kind of urban, suburban community center that's surrounded by nothing but desert. So one of the things that we're doing is we're working closely with the Riverside County Housing Authority in its Project Room Key initiative to house over 1,200 people that have called in since COVID-19 as part of the county's 3 population housing initiative. So that's 65 and over, pregnant women, and people living with HIV. So True Evolution is the lead agency on housing the people living with HIV, and we received over 60 referrals in 1 week. And we only have the capacity to do about 25 to 30 in our entire scope of work. So we received 60 in 1 week. And there's a lot of challenges with being able to scale up telehealth services because these clients are being placed in motels in 3 different scattered sites. And so, yeah, that's our big issue. That's what we're going through. I'll pause there and we can get into more details if necessary.
Great, thank you. And it looks like Rosa and Angela might have just stepped away for a minute, but when they come back, would love to have them introduce themselves as well, down in the Imperial Valley area. Yeah, so I think a number of you kind of touched on this during your introduction, but would just, you know, I think maybe to get us started, can you tell us a little bit about, you know, how COVID-19 is impacting your communities? Anything that you haven't, you know, had a chance to share yet? You know, what are you seeing? What are the needs and impacts right now?
So
Sure.
you want us to jump in or go to order?
Yeah, why don't you go ahead and start us off, Erica, and then yeah, anyone who wants to join, who wants to speak, please feel free to.
Okay, so again, my name is Erika Garcia, and the COVID-19 has been affected us on different ways. Personally, in the economic situation, because we have to pay rent, utilities, and all the other family expenses. In the emotional, as we came from the natural disasters as the King Fire just a few months ago, in October 2019 also, and which we were evacuated around a week from our houses, and with that almost 100% of probabilities that we was about to lose our entire town. And now the health crisis of the COVID-19 and the shelter-in-place order. And I put in in perspective my personal challenges, just to give you all a bigger picture of what our Latino communities in our area are facing now. So my commitment with LGBTQ Connection is to bring information about resources to the Spanish-speaking families, about family acceptance, and it's about to create awareness about the dangers of rejecting our LGBTQ family members, and trying to create a social support system to help each other to deal with the challenge of being different. Of course, it represents a huge effort because of the shortness of resources to support our Latino families in their primary language, and because the values of our Latino communities possess. To approach our Latino communities in an effective way and a positive way, we have to be very respectful with our beliefs and validate the family emotions, principally the parent emotions. So to do that, we have to meet Latino communities in face-to-face meetings, community events, school events, and more. And it is because not many people know about the available resources, and most importantly, because not many Latino families know that there are resources and available in our Spanish language and with cultural sensitivity. So it is difficult for Latino families to talk about their emotional problems by phone, and principally if they do not trust you, they will not tell nothing about they will not even contact you. So people who in which or who I talk to, they trust me. And I think so the principal problem right now for our Latino community is that how to reach them, how to continue communicate with them. So our organization is putting out on Zoom and on video some programs. And what is important for me and for our community that they are sharing all this information on both languages, trying to be inclusive and to let everybody know that we are here for them.
Thank you. Yeah, I do have some examples of what those messages look like, Erica, that you shared in both English and in Spanish.
So to share about what?
Oh, I just have up on the screen for folks who are on the webinar, those flyers that you shared with me. So folks are interested in what some of that outreach looks like in Sonoma and Napa counties.
Mm-hmm. So there are specific activities, community activities for our LGBTQ individuals, but they are not limited to, so they can share with family and folk members and maybe those who they are sheltered in. So are principally to keep that connections and to keep building that that relationship with the community and try to keep us informed and connect.
Yeah, thank you.
Yeah.
Brian, did you want to share a little bit about some of those impacts have looked like in Visalia and in Tulare and Kings counties?
Sure. So just to echo, probably everyone here, a lot of shift in focus for us, like just to provide some direct service. We've never done that before. We're a small community center that has typically just provided, but provided peer support, access to mental health, a drop-in center. But now we're, going to be dispersing things, right? Items, rental assistance, things like that. So that's kind of exciting for us. That's like something we've always wanted to do, but wouldn't be funded to do because of where we are and a lack of trust and a lack of opportunity for LGBT folks to do distribution. So this has sort of opened the door for us into that. So that's exciting for us as a center. But we've seen just in the last 3 weeks, we've had 4 new HIV positive cases come to us for ADAP assistance. And we have about 30 cases per year in our area. So that's quite an uptick for us. I mean, more positive cases in that time period than we've seen in the last year or two together combined. So that's concerning to us, but also, you know, we're able to provide access to ADAP and Ryan White and things like that, which is good. The other thing is that our recovery community is really suffering right now. We've been able to facilitate 2 treatment placements in the past week. So people that have been coming to our recovery groups and staying sober and been engaged have, you know, relapsed and don't have access to culturally competent and sensitive rehab facilities in the Central Valley. So we have to partner out, and you know, one of our participants is going to Los Angeles today for treatment. So just that, you know, we're just starting to see. Those are the things that we've noticed, like just this week, that that are starting to like concern us, and we're sort of just addressing them as they come up. But yeah, just that those 2 populations are really vulnerable. Folks living with HIV, folks who are in recovery. The rest of it, you know, being able to stay engaged with a lot of our participants has been fairly easy. But again, you know, a lot of our participants are in rural communities without access to internet. So we started a Discord channel so that people can text, but that still takes some sort of Wi-Fi, or they might not be able to video, but they can still text. And then you're talking about data and things like that. But we're trying to be as flexible as we can. But yeah, I just thought it was, you know, and then the other thing is that we partner with several different organizations to provide HIV wraparound services, and those folks are staying at home as well, and the office hours are different, and you know, people are having a really difficult time contacting folks that they need help from. I think that that's gotten a little bit better, but yeah, we're just taking it as we go.
Thank you. Before I have anyone else kind of chime in on some of the impacts you're seeing, Rosa, welcome back. I don't know if you and Angela want to take a minute to just introduce yourselves and where you're coming from, and if there are any impacts from COVID-19 on your communities that you want to highlight for folks. Oh, I think you are muted, it's saying.
Okay, can you hear me?
Yes.
Yeah, we are in Imperial County, and we're very close to the border of Baja California, Mexicali, and I think I can relate to some of the other challenges that other rural communities are facing. We do work with a lot of Spanish speaking, and one of the things that I've seen is that since the shutdown, it's been hard to stay in touch with many of our consumers because of the not knowing how to work the technology or not having access to internet. But we try to do as much as possible. We do get a lot of phone calls. People will call to check in, and usually if they need something. So I'm a little concerned because many of them have kind of closed that door, and they're staying away. So we have tried to be creative to reach out to them. We just had an LGBTQIA+ Zoom meeting yesterday, and it went very well. It was very refreshing, but we had people from outside of the Imperial County that also joined. So it was good because we got to meet some new people, but some of the folks that I was hoping to jump in that are part of that part of the center didn't. So we're going to try it again in 2 weeks, hoping that they will join. But even for this meeting, I contacted specifically some of the people that come to our transgender support group during the day or during the time that we offer the group. They do come, and I appreciate that. But it's very hard to get them involved, to get them to tell their story, to get them to participate in something like this, which I think would encourage them much. But I was able to get a hold of Angela, and Angela has been with us for a short time, but she told me, if you need me to speak, I am willing to speak. And it has been very challenging in this area because we still don't have transgender specific services. For the doctors that are seeing some of our trans people, it's basically having to say, please, could you see and talk to them? And they've reached out to us. It's 2 female doctors. They have reached out to us to let us know that they don't feel too comfortable, but they're willing to learn. So they've been learning right along with us, and we appreciate them. And they happen to be from a local clinic who also does HIV case management. So I'm grateful for that. But they still have a lot of questions. And to send them to training is very hard because they're so busy. The other challenge has also been therapy. And even, well, let me tell you this, the only endocrinologist in Imperial County that could help our trans population refuses to see that for HRT, for the transitioning. So getting an endocrinologist in this area is hard. So we still have to find transportation for them to go either to San Diego or Palm Springs. But outside of that, I think that we're doing the best that we can. They know we're here, and if they do need us, they know where to find us. But I'm gonna go ahead and ask Angela to chime in, and maybe she can tell us a little bit more about her own personal challenges. Angela, you there? You have to unmute yourself, I think.
Hello, can you hear me now?
Yes.
Yes. My name is Angela Soto. I have been going down there to the Imperial Valley LGBT Center for a short while. I'm a recent transplant here in the Valley. I was born in this valley, but I spent 30 plus years over in Ventura County. And so with rental prices that went up about a year ago, my family was displaced, and we ended up having to move down here because of that reason, because it's more affordable. And I am a caregiver. I take care of my parents who are disabled. And with the COVID-19 measures that are taking place, basically, I'm one of the fortunate people who happens to be trans. I consider I'm in a privileged position because I do have a steady stream of employment. I don't need to go out there and expose myself. I work from home. I take my parents to their appointments, take them to the hospital. I get their medicine. I do everything. I cook and clean. I do everything I have to do every day. And I do worry about things like healthcare. I do know about that endocrinologist that refuses. I called into that office myself, and the receptionist, she basically in a coded message to let me know that no, you are not able to get hormone replacement for what you want. Basically, the doctor only sees her patients or people who have regular problems. So I got the message and I didn't call them, anymore. Basically, I want to get my health care too. And hormone replacement is a part of that treatment for someone like me. And yes, I worry about what I would do in the event that with this crisis, my parents were to catch this disease, or myself. It would pretty much place me in economic uncertainty so fast. And that's why it's very important to reach out, I think, and that this forum, if it can be used for that, to set forth some information that can help us and stay connected, I think that would be a good endeavor.
Yeah, absolutely. And thank you so much for getting on and for sharing those experiences and those concerns that I think so many other people are sharing right now about the economic uncertainty and being able to maintain access to crucial healthcare, including HRT. It's definitely a big concern during this time.
Amanda, can I chime in really quick to speak with Angela?
Yeah.
Angela, we have struggled here finding local doctors that understand that trans care is primary care, and that you don't need to be an endocrinologist or a specialist to provide hormones to folks. So we've partnered several times with UCSF in San Francisco, and they will see patients through telemedicine and prescribe hormones to trans individuals.
Oh, wow, that sounds wonderful to me, because I'm an individual who, for the better part of most of my life, I have not had health insurance. I think I had health insurance under my father back up until 1998, and that was around the time I was 18. And I think the last physical I ever had during my minor years was when I was 14. And one of the reasons why I stopped going was because I felt embarrassed during a physical examination. I felt embarrassed about my body and I was uncomfortable. And I really put off going to doctors for a long time because of that reason. And before the world changed, when I went down to the LGBT center with Rosa, she encouraged me to look into some health insurance options. And, I had let myself be carried away with the news of, I know that doctors have the right to turn down patients. It's kind of like when you go to a store, we have the right to refuse service. And some doctors do have that mentality. And on the news, you can hear it from President Donald Trump that he is attacking the community, and especially the trans community. We seem to be a scapegoat at this time for these misfortunes that have befallen the nation, and they start to think in this manner. And well, Rosa, she had me think about my health care, and I signed up for one of the exchanges here with the state, and I signed up for a PPO, but then the crisis happened. I've already gone to have a physical with a local doctor here, but nowadays you don't know which doctor could be on your side. if they really do want to help you with something like HRT. When I walk into the office, I don't know if that doctor is just being nice or if they're really going to help me. And I think I will always have that question, that mistrust from my part, you know.
Yeah.
Because I really do want to get this health care, and I want it to be my primary care because it makes me feel better about myself. It makes me feel more aligned with my body, my mind, my spirit. But I don't know if there's going to be a way later on that maybe these doctors can identify themselves if they're willing to work with the community or not. That would be good for us to know which ones are out there and who can we count on. That's very important.
Yeah.
But thank you for the tip. I will definitely keep that in mind about that US, those doctors out there that do telemedicine. I really interested in that information, and if we can share it here with other people who are isolated and in these same rural areas, just like Imperial, whether it be here or in San Bernardino or other isolated areas, sure, we can get creative solutions.
Yeah, absolutely. And I actually wanted to just address one of the things that that you shared, Angela, around discrimination by providers. We do have protections here in California against discrimination, and we're actually very fortunate to have someone from ACLU on the line. Amanda, do you want to take a moment to just address that?
Absolutely. Thanks, other Amanda. This is Amanda Goad from the ACLU of SoCal. And hearing that really unfortunate part of Angela's story, I just wanted to make sure everyone understands, while businesses have sometimes been known to put up signs that say things like, "We reserve the right to refuse service," and healthcare providers have been known to do sometimes less obvious versions of the same thing, it is not legal in California for any business, including a healthcare provider, to turn someone away because of who they are, whether it's sexual orientation, gender identity, race, or something else. It is permissible for a business to decide which services they're going to make available to the community at large. And that can play out in some tricky ways as to, say, a doctor's office that isn't going to provide a particular treatment to anyone. And doctors will sometimes say that they don't feel comfortable or qualified to provide a particular course of treatment for a particular medical issue. But if anyone is being told that they're not eligible for service because of who they are, that is a problem, and there would be a legal remedy for that in California.
And they should call the ACLU?
Sure, that's one good option, and we of course cannot represent everyone in this state who has issues, but we can help you find the right resources and figure out what your options are.
Thank you very much.
I wanted to make sure that we did address that, and we see it happening despite the fact that it is against the law, and we know that our sometimes our legal protections are better than enforcement of those protections. But I think it is really important to know that, you know, what providers are doing in those cases is illegal and is against the law. And you all, our communities, are on the right side on this issue. Also, I got another question in the question box that I wanted to open up to the group to see, to our experts here, to see what experiences you all have had. I think it's along the lines of, you know, having trouble with reaching clients. So let me find the question. This is from Emily at Fresno EOC LGBTQ Resource Center. We were facilitating a queer youth support group in person before shelter in place happened. One of our concerns has been the radio silence from kids under 18 who are vulnerable to insensitive family members. There's only so much we can do on social media before they interact. Has anyone else here had a successful experience outreaching with LGBTQ youth under 18 during this time? Anyone have ideas or thoughts that they want to share?
This is Gabriel. Our focus has largely been broadly on the homeless population. That's just been what our immediate emergency need is. However, my team did tell me recently that they were very concerned about the radio silence from the under 18 population. And so, to my understanding, and don't quote me, but I believe we are going to be partnering up with our local school district, at least in Riverside City, and they are wanting to organize an LGBTQ kind of support group line for LGBTQ youth, specifically when in a certain school district. But I think the only reason why that I can see that is a viable intervention to be able to see what's been going on and why is there such radio silence is that it's being co-led with the school district. I feel like they're creating an ability for us to reach them because we don't have necessarily a large database of all the LGBTQ youth. So I think the only way we're able to really put our hands on the under 18 crowd has been through these institutions like the school districts. So I don't know what that relationship is like. We haven't always had the most empathetic school districts, quite the opposite, quite hostile. So I don't know if there is that relationship with your local school district, but that's our modality.
Yeah. And also, may I add something?
Yes.
Okay, so this is Erika again. So what in our area in Sonoma County and Napa County, this has been conducted some information about the resources of LGBTQ connection and some individual acceptance and the resources of family acceptance through the school district. And we was on Napa County first, and we was trying to reach the Windsor School District to add those programs, but they are on plans also. And I also want to share some of the experiences that I saw during the community events. So on February, we have the MECHA conference at Santa Rosa Junior College, and we have a table there with information. And we received on that conference, about 700 students, parents, professors, teachers, allies, and many of them got to our table to ask for information that I was very happy to see it. And one of the feedbacks that the youth underage told me is that they were happy to see an adult, a Latino adult, sharing that information, because many of them do not share how they feel with their parents, because they think that they will face rejection, and they was not ready for that. So also other teachers tell me that they were happy to see that there are that resources also in Spanish, because on the Latino community is very important to share this information with parents, because for us, family is very important. So you cannot not just reach the Latino youth without reaching Latino families. So their LGBTQ connections have those programs, and with the community events, we are reaching more people that we expect, and we are happy to do that and that's why it's very important to have those resources available on Spanish. And also, I sent you, and I don't know if you can go to the next slide that I sent you, that the information of the events on English, just to everyone can have the opportunity to see. But going back to those experiences, it was I'm seeing and people or families or individuals underage and entire families are ready to hear about information. And also under my experience, I has been contacting other different religions members that they want to know about the LGBTQ community, about the resources, how they can approach to the families within family-friendly talking or chats and all that. So I'm very happy to be collaborating with LGBTQ Connections and bringing this information and resources in Spanish and to the families in our community.
Great. Thank you. And I see we had a couple of suggestions come in through the question and answer box too that I sent out as well. We're getting close to time. So I do just before we hop off, would love to hear kind of like some closing comments from folks who are experts here, just around, you know, maybe one thing that one resource or strategy that's really worked for you in these times that you want to share with folks, or maybe like one policy or change that you would like to see from the state to help support your communities. So it's a pick your own adventure. If there's one of those questions that's really speaking to you, you know, we'd like to make sure that we're getting those asks to our policymakers and also getting resources and information out to our communities. Brian, do you want to go first? No? Okay. Buzz, do you want to go first?
Well, I was glad that, you know, providing internet service to everyone came up earlier. I've got some people, for a variety of reasons, are not able to continue with the class on Zoom, and I worry about them. We are trying the old-fashioned telephone tree, where people have committed to calling certain people periodically to check in. But I also know that we LGBT elders tend to have more health issues. We didn't take the best care of ourselves when we were younger. We didn't have great self-esteem, so we drank too much, partied too hard, and now we're paying for it. And with not being able to have regular health services and not having access to telehealth, I worry that some of our folks will, their conditions may worsen. Other than that, I think our efforts at Zooming have worked pretty well for most of the people. I do it twice a week for our local group and every week for my class, and that's really helping with isolation for those that can participate. So, thank you. Yeah.
Great. Thank you.
I think I'm ready now. I got it in my head. I really, really enjoy like the conversation we have around rural LGBT issues, because I think they are different. I often feel like I'm in a time machine and I'm talking to people that feel like this argument's already been won, and we live in California, so what's the big deal? I'm wondering if there's a way that we could, you know, do something like this more often, or have a collective voice around rural LGBT work and bring that to the state, because it's just different. And the other issue I would say is that, you know, a lot of folks that we see are use Medi-Cal and don't have a lot of choice where they go to see a doctor. And we have some large FQHCs that sort of are monopolies in our area, and they don't have very inclusive policies, or they do at this place and they don't at this place. And so is there some, or they're just breaking the law, you know, they're not collecting SOGI data, they're or one place is, their rural health clinic is, but they're not here in town, you know, or they're providing HIV tests with no education or advocacy around PrEP, which is like a law now, you know. And so is there a sort of a watchdog kind of thing other than just like the LGBT center that's this like tiny thing? And if there's a watchdog sort of structure that we could put into place, or even talk to legislators, you know, if these large community you know, hospitals and healthcare centers aren't following the rules, you know, is there some sort of way to make them? You know, they receive our money. And so I don't know, those are kind of my brainstorm ideas, because we can only do so much, you know, locally. So yeah, sometimes when they get a call from the state, they sort of seem to listen.
Yeah, it's funny how that works, huh?
And sometimes they still don't.
Yeah. Yeah. Thanks, Brian. Gabriel, do you want to?
Yeah, I'll just say from an individual standpoint, we're not just talking about orgs and institutions, but we're also talking about people and our individual lives. So my advice of what I've been doing has been to keep a regimen. You know, as someone who travels, as someone who, you know, is moving around for work and advocacy and you're going places, you know, it's been really emotionally and mentally hard for me to like be trapped in my studio, you know? And so having a regimen is something I'd recommend to everyone. Like, even if you're just in your four walls, have a morning prayer, have a morning cup of coffee or a cup of tea that you drink, go for a walk, but do something with repetition, so that the days don't feel mundane and you have mental health side effects from being trapped inside. So that's the first thing personally. And then the second thing for institutions, you know, although there is so much scariness going on and there's so much that is just calling upon professional skills that I did not know I had to weather these storms, I would say that there's also real areas of opportunity. I think when there's chaos and when there's disruption, it also opens up small windows and pockets for innovation, for change, for nimbleness, for adaptivity, for advocacy priorities to get raised that were never raised before. And so let's not just wallow in what is wrong, but also let's collectively look at the pockets and holes and areas of opportunity where we could, as rural regions specifically, where we could advance an agenda that otherwise we have historically been silenced on. And so that's what I would say from an institutional perspective.
Great, thank you. All right, did anyone else want to, any of our other panelists want to add anything? All right. Well, thank you so much for those insights, for those recommendations. You know, I really appreciate you all taking the time to be with us today. I think the great information that you shared with the Assembly members, and who, as they mentioned, will be having their budget subcommittee hearing on Monday. And hopefully we can see a number of these priorities issues, you know, really pushed forward and advanced in some of those state responses. And hopefully we can also continue to keep these conversations going and keep making sure that issues facing rural communities, rural health, LGBTQ youth and elders are a part of those conversations. So thank you all for joining. We will be doing these on a basically bi-weekly basis. For the most part, we're looking at different topics going forward. So if you do have recommendations for topics or panelists please do let us know. We've talked about potentially doing, having some focus on mental health and behavioral health right now, which I know came up during this call and has come up during a number of them. But again, thank you all for the work you're doing. Thank you for being here today, and look forward to working with you all going forward.
Okay. Thank you all.
Thank you.